Hi, welcome back. This is Dr. Jin Sung, and welcome back to the Tuesday afternoon show. It's 12:30, and we're going to get started. Before we get started about the Crohn's and ulcerative colitis information, what I'd like to announce is a seminar. We will be doing an in-office seminar next Thursday, the 14th. So September 14th, Thursday, 6 p.m. to 7 p.m. So it'll be after office hours here in the office. Our address is 126 Merrimack Street, Methuen, Mass. And I'll put the contact information below the video. Our phone number, you do have to call in to reserve your spot because there will be limited space. So our office phone number is 978-688-6999. Again, the number is 978-688-6999. Again, the seminar will be next Thursday, the 14th, 6 to 7 p.m., and it will be limited to 20 people. So please call in and reserve your spot, okay? So today, what we're going to talk about is ulcerative colitis and Crohn's disease. So what is it? Okay, so the traditional definition is basically an inflammatory process that affects our GI symptomatology. So let's go over some of the symptoms regarding Crohn's disease. Crohn's disease can affect basically anywhere from the mouth all the way down to the rectum or the anus, okay? So recurrent frequent diarrhea, rectal bleeding, unexplained weight loss, fever, abdominal pain, fatigue, and reduced appetite. Okay, so those are very broad things that affect the GI tract. The interesting thing about it is with Crohn's, those symptoms are very similar to ulcerative colitis, but ulcerative colitis is basically affecting the colon, a very low part of your GI tract, just above your rectum. Okay, so those symptoms apply to not just Crohn's, but ulcerative colitis. So let's go recap that again. Rectal bleeding, unexplained weight loss, fever, abdominal pain, fatigue, and reduced appetite. Okay? So what are the known causes for Crohn's disease and ulcerative colitis? Now, in the traditional sense, they're going to say it's genetics. So if mom and dad or someone else in the family has ulcerative colitis, the likelihood of you having ulcerative colitis or Crohn's disease goes up. Okay? The other aspect of it is immune system. There is a certain thing that affects your immune system, or a trigger, that creates an inflammatory process in your GI tract. Basically what they're saying is it's an autoimmune disease, although they technically will say the exact cause is unknown. But really, there's an immune process that's going on that's affecting the entire GI tract in terms of Crohn's, and in the lower colon for the ulcerative colitis. Okay? So, and the other factor is environmental triggers. So they list environmental triggers, things like bacteria, viruses, and certain other things. What I'm going to tell you is all three plays a part in terms of triggers. So genetics plays a part. Immune modulation or autoimmune disease. So let's say you have one autoimmune disease like rheumatoid arthritis or Hashimoto's thyroiditis. So the person who has an autoimmune disease, the chance of developing one of these bowel conditions goes up, because one autoimmune disease can create another autoimmune disease because of this constant cascade of immune responses. Okay. The biggest thing that I see in my office is it's not just genes and immune system and autoimmunity, but there are a lot of triggers. The triggers can be anywhere things from fungal infections in the GI tract, bacterial infections, parasitic infections, heavy metals, right? Or genetically, or in terms of from mother to child, there can be some things passed down. So if a mother has poor dietary habits, they have a lot of fillings in their mouth, they swam in a lake and they have a parasite, And they have all these immune responses going on in their body, and then they get pregnant. All that immune response will eventually make it to the fetus. So the fetus, or basically the growing baby, has an inflammatory load that they're stuck with right from birth. And then when you have birth, and then instead of having a vaginal birth, they have a C-section. So basically they don't get the good bacteria or the flora from the mother, and they have a C-section. Based on that, and the mother does not breastfeed, she has to go back to work. Basically they give them formula. And they give them, let's say, soy-based formula, right? And a lot of the soy proteins are not great. They're estrogen modulators to a certain extent, and it can create some problems for the child. And then you take the child on soy-based formula, and then you give them, I don't know, gluten, and they might be gluten sensitive or dairy sensitive, right? So the child is set up to the point where their immune system is maybe not as strong as it should be, and then you give them things that create an immune response. So environmental triggers can be anything from bacteria, viruses, metals, parasites, the birthing aspect of it, and then food. How can we forget food, right? We have so many different food triggers out there, and it's because a lot of the foods are genetically modified or hybridized to the point where it's not recognizable. It's not the same type of food that our grandparents has eaten in the past, right? So, and then you layer in on top of the food or GMOs or hybridization, the pesticides and herbicides and these things that create problems for our body in terms of immune response. A lot of these herbicides and pesticides will start to bind with the protein and changes the way the protein structure looks. So if it does that, then your body will recognize this protein structure with some chemicals on it, basically, as a foreign body. And your body will go, hey, that's a problem here. We're going to have an immune response. And then if you're genetically set up that way, and then you have autoimmune disease in the family, and then you have all these environmental impacts, right? It can create a severe immune reaction. And basically that's what it is. If you look at ulcerative colitis and Crohn's disease, it's really an overreaction of the immune response. It inflames the GI lining, and it creates bloody stool, diarrhea, abdominal pain, fever, right? All these things can happen as a result. But some of the other symptoms that people don't talk about, or other physicians may not talk about, is joint pain. Because if you have problems with your immune system, then it can create inflammation. Inflammation can lead to joint pain, muscle weakness, lack of endurance, right? All these things can happen. And then it creates nutrient deficiencies because the inflammation, you don't break down your proteins, your minerals, your fats. It doesn't absorb. That's why you lose weight sometimes when you have these conditions, because you're malabsorbing. You're not absorbing your nutrients for proper function. And then sleep disturbances and neuroinflammation, basically brain inflammation. If you have your stomach basically on fire with inflammation, your brain is going to be on fire the same way, because inflammation will eventually cross the blood-brain barrier, and you have this low-grade brain fog, right? Just never feels clear. Your thought processes are not, logical sometimes. You get angry for no reason. You get depressed for no reason, right? My life is wonderful. Everything is great. My job is good. My wife is great. But I'm a miserable SOB, right? Because I don't feel good, and there's inflammation in our system. So there's a big problem in terms of how to modulate these things, right? What I'm going to tell you is very basic. Go back and look at your history. Go back and look at what you're putting in your mouth, right? And go back and really be honest with yourself. Am I doing everything I can to help my GI symptoms? Or am I masking it, right? Am I on an anti-inflammatory? Am I on an immunosuppressant or immunomodulator? Am I on a steroid? you have to be on this thing maybe forever, and yet not quite feel the way you should. So you got to look at these triggers. You got to go find out. You got to dig deep to figure out what's going on. Right? In our office, what we do is we do a genetic type of testing in terms of stool testing. So rather than just go look at the big picture of just like, do I see a microbe? Right? Let me give you an example. If there's a crime and someone is murdered, right, and the detective walks into the room, and in the olden days, they would just look and say, oh, the lamp is fallen, this person is over here, there's a blood splatter, and then, do we see a weapon or anything like that, right? That is our traditional stool test. We just kind of look to see what's there. And you may or may not find something. But if we did a genetic SNP, not a SNP test, but a genetic profile on these parasites and bugs and viruses, you can actually find them. So the test that we do is more like the forensic scientist who comes in afterwards, looks at everything, swabs everything, and then takes it back to the lab and looks at the DNA, right? You have to be more specific, because if you can't find it, and you can't see it, and then they just say, hey, we don't know what the cause is. The cause is unknown, but you have it. It's a problem, right? You need to figure out what's going on with the patient. So if you come in, what I like you to do is you need to figure out what's going on, what the underlying cause is. It's very important for you to do that, okay? Again, next week, we're going to have a seminar, okay, on the 14th, on Thursday, September 14th, Thursday, between 6 and 7 p.m. We're going to go into the GI tract, everything from SIBO, hypochlorhydria, or low stomach acid, to GERD, to ulcerative colitis. It's a seminar you do not want to miss. We're going to give out a ton of information, and I'd like to invite you to be there. And it's going to be limited to 20 people, so please call the office, 978-688-6999. And again, I'd like to invite everyone to be there. It's going to be a great seminar. All right? We'll see you next week. Take care.